Thank you so much for trusting Atlas Vein Care with your vein treatments. So typically, vein treatment with us is 3 different parts. So the first part of treatment is the vein thermal ablation. The second part, which usually is the cleanup part related to areas of vein where we can't safely use treat or branch veins and varicose veins, is what is called foam sclerotherapy or Varithena. The other part, and just as important as the treatment itself, is your necessary follow-up. So first, let's start with the thermal ablations. Here is what you can expect. Typically, treatment takes less than 30 minutes. You're up and walking right after treatment. You can drive here, drive home. You don't need to fast, which means you can eat like normal and drink fluids like normal. You can take your medicines just like normal as prescribed, including medications like blood thinners or aspirin. When you arrive for your treatment, if this is your first treatment, you will have to sign consent forms. This is very important because it just gives us permission to safely and thoroughly treat you. Once this basic paperwork is complete, you'll be taken back to your treatment room by one of our medical assistants or medical receptionists. Once you reach this room, you'll be asked to change into some of our shorts. The good news is we don't use paper shorts. We use fabric shorts. They're way more comfortable and they won't fall apart. Once you've changed into the shorts, one of our medical team will come in and they will get you prepped and cleaned on the leg of where we're going to treat. When we position you for treatment, this is usually done either where you're laying on your back. If we're treating on the back of the leg, you might be positioned on your belly or on your side. Once you're positioned properly, you will be draped with some blue drapes, which we ask you then not to touch, and we will clean your leg with a operating room grade antiseptic or soap. Unfortunately, this can't be heated up, so it will be kind of cold on your skin. Once your leg has been cleaned and prepped, we will then come in to perform the treatment. Your thermal ablations will all be done by myself. If you're coming in for any of the foam sclerotherapy, that treatment may either be done by myself or one of my nurse practitioners. For the thermal ablation, the steps are like this. I will come in, I will put some cold ultrasound gel. Unfortunately, I can't heat it up because to keep everything clean. I'll make a couple marks where I'm going to numb your skin with a little skin marker. Where I mark with this marker, I will numb with a very small little needle, about the size of a piece of hair. Through these little numbing areas, my little treatment device that's no bigger than the tip of a ballpoint pen under ultrasound will be placed within the vein that we're going to treat. Once that's in place, I will then surround that vein with numbing medicine. Typically, if people are going to feel much of anything during this treatment process, this can be the more uncomfortable part. 98% of people on a scale of 1 to 10 will say this is maybe a 1 to 3, maybe a 4 out of 10 when it comes to discomfort or pain. Now, I will tell you that occasionally some people's legs are very, very sensitive. So we take that into consideration. I approach everybody's legs like they're going to be super sensitive. I'm allergic to pain, so I simply assume that everybody else is allergic to pain too. Again, through these little pokes, I will surround the vein with numbing medicine, which is confirmed under ultrasound and also through monitoring done in real time through the treatment device itself. Once everything looks good, we will then treat the vein. The actual treatment part itself will typically take anywhere from about 1 to 3 minutes from start to finish once everything is numbed up. Once the vein is thoroughly and safely treated, this device comes out, so no hardware or foreign object is left within your leg. Once this process is done, we clean off the leg from the ultrasound gel. We then gently wrap your leg with some bandage and some elastic Velcro wraps, and you're then sat up and the procedure is complete. From start to finish, typically from the time you enter the room till the time you're leaving, is 30 minutes or less. You're up and walking, and you can then be on your way and drive yourself home. If you're having other treatments with this thermal ablation, this type of process will be repeated with every other vein that will need to be treated based on your specific customized treatment plan. So for most people in their treatment plan, they will also need what's called foam sclerotherapy. The FDA-approved version of this is called Varithena. This uses a medicine called polidocanol, which is turned into a medical foam. Under ultrasound guidance, this foam is injected directly inside the veins medically that we are going to treat. Foam sclerotherapy, or sclerotherapy in general, is the most common vein treatment done in the world. Millions of cases done safely all over the globe. This medicine, instead of using heat to close the vein, uses the medicine itself to actually cause the vein to close and collapse. Now, you might be wondering, okay, so what happens to this medicine? Well, what I can tell you is that your body naturally will actually neutralize this medication in less than 30 seconds. So you don't have this medication just floating throughout your body. Again, this treatment is done just with little pokes through the skin, again with a very fine little needle, not much bigger than a piece of hair. This treatment, from start to finish for most people, will generally take somewhere between about 10 to 20 minutes. Once this is done, the ultrasound gel is cleaned off that's used to visualize this vein with ultrasound beneath your skin. A gentle compression wrap that's Velcro will be placed on the areas where we've treated you, and you're up and walking. Just like with thermal ablation, this treatment can be done in a way that you can walk in and walk out and drive yourself home. Now, the third part of treatment is the follow-up. So for most patients, in fact, pretty much every patient, this will include what we call a 1-week and a 6-week follow-up and ultrasound. The 1-week ultrasound and follow-up is extremely crucial. This does a couple things for us and for you. The first thing it does is it confirms that the areas we treated were closed successfully. So this confirms the technical success of the treatment. The second thing this does is it looks for any potential complications, such as a blood clot, which can happen after vein treatment. It's very rare, typically well less than 1 in 1,000 cases, but it can happen. And so this 1-week ultrasound, again, confirms that your treatment was successful technically, but also makes sure that we're not dealing with any blood clot or anything like that after the treatment itself. You will also have a consult with us here where we go over that ultrasound with you, answer any questions you might have, and then you're on your way. On your way out, you will schedule your next follow-up with us, which is typically about 6 to 8 weeks after your treatment plan is completed. Now, this 6 to 8 week ultrasound is important for several reasons. Occasionally, treatment can fail, and areas that were treated will try to reopen, potentially causing new symptoms. So this ultrasound confirms that what we've treated has stayed closed and that nothing new is peeking around the corner that might need to be addressed. Also, at this 6 to 8 week mark, you're moving down your line of your healing process after treatment. So this also gives us a chance to answer any further questions you might have, and also make sure that things are healing and improving like both myself and my team and you want it to.